Okay, we're going to look at a few conditions of the brain. One is hydrocephalus. This is where fluid accumulates in the arachnoid space, creating swelling. Sometimes you've probably seen pictures of infant where their head just looks literally like one of those alien cone head things. Um, that's because their cranial bones are not fused yet, and it can expand. So the head can swell, but in an adult, this is very dangerous because the skull bones, the cranial bones, cannot expand, and the swelling can lead to brain damage. The pressure of the fluid can crush tissue, including nerve tissue, and medically, what they end up doing is surgically inserting a tube to drain the excess fluid. Okay, the blood-brain barrier is a very important structure. I do want you to keep in mind that this is considered immature in an infant. So an infant's brain is very susceptible for toxins and chemicals and metals and drugs and preservatives and additives and all that kind of stuff, like thimerosal and mercury and aluminum, phthalates and silicone. Reverse transcriptase can cause problems, and on it goes, because their blood-brain barrier is immature. And because the brain is very sensitive to change, any alteration in chemicals can result in permanent damage. So infants need to be protected. They're vulnerable. So you really want to be careful what they're given. And of course, in my opinion, the only thing an infant should be receiving is breastfeeding. So there really is no need for any other chemical input. And if for no other reason, it is to protect that brain. Sodium, potassium, and other neurotransmitters are necessary for nerve impulse. So neurons are kept separate from blood-borne substances by the blood-brain barrier. Water, glucose, and essential amino acids can pass through the walls of the capillaries. But waste products like urea, nitrogen, proteins, and most drugs are prevented from entering the brain tissue because of that barrier. The older we get, the more mature that barrier becomes, but in infants, they just don't have that maturity yet. And the blood-brain barrier is not that effective against fats, gases, and other fat-soluble molecules that can diffuse easily across plasma membranes. So alcohol, nicotine, anesthetics can affect the brain. Okay, a brain hemorrhage is where you get intracranial swelling that results in or can result in pressure on nerve tissue, and that can cause severe damage. A CVA is a cerebrovascular accident, also known as a stroke. This is where a clot gets stuck in a brain blood vessel, which damages that part of the brain. So the more central the lesion here, the more damage there is, the more the more periphery to the periphery you go, meaning further away from the center of the brain, the less the damage. And of course, depending on where at in the brain was hurt is going to depend on what the stroke victim looks like. Okay, it could be minimal damage, could be severe damage. A TIA is a transient ischemic attack. These are considered an incomplete stroke. and it does restrict blood flow, so it's not 100% occlusion of blood to the tissue. That's your CVA. It's an incomplete stroke with restricted blood flow, and the person can experience numbness, temporary paralysis, impaired speech. These are typically not permanent, but it is a red flag to do further investigation to figure out what is going on. Like, why is this person throwing a clot? And, why are they having a TIA?